Hello, grade 9 students. In this video, we'll continue about the cardiac activity, part 2. Here are some notes you have to know about the heart. First, you have to know that the heart beats in a rhythmic, periodic manner. Second, you have to know that the heart average beating rate is about 70 to 75 beats per minute. So every beat takes about 0.8 seconds. So every minute it's about 60 seconds. So 60 divided by 75, so it will be about 0.8 seconds. And you have to know that the every beat the heart contracts for about 0.4 seconds and it relaxes for 0.4 seconds. Moving for the cardiac activity. As you said that every beat takes about 0.8 seconds. These they are divided into something called systole and diastole. So systole, we have the auricular systole and the ventricular systole. These they represent the contraction and their time is about 0.4 seconds, while the diastole, it's the general diastole, it represents about 0.4 seconds and it's for the relaxation. So relaxation for 0.4 seconds and contraction for 0.4 seconds. Let's first with the phases of the cardiac cycle. Auricular systole, which is abbreviated as AS, auricular systole, it stays for about 0.1 seconds. What are the events during the auricular systole? These notes you have to study them. First, the auricles they contract. We said that the systole is for the contraction. So the auricles they contract and the blood will flow from the auricles toward the ventricle. Then in this phase the bicuspid and tricuspid valves they open, whereas sigmoid valves they close. So we have three main events. Number one, auricles contract, that's why auricular systole, so the contraction of the auricles. The blood will flow from the auricles toward the ventricles. You have to know that the bicuspid and tricuspid valves they open and the sigmoid valves they close. Moving for the second phase. Second phase of the contraction is the ventricular systole, VS, ventricular systole. It remains for about 0.3 seconds. So ventricles they contract since it's the contraction phase, systole. So the ventricular systole, contraction of the ventricles. Number two, the blood flows from the ventricles toward the pulmonary artery and the aorta. Number three, what do we have? The bicuspid and tricuspid valves they close. Why? To prevent the backflow of the blood into the auricles, while the sigmoid valves they open. So let's repeat this. Ventricular systole, so the ventricles they contract. This is the ventricular systole, the systole is the contraction. The blood flows from the ventricles to the pulmonary artery and to the aorta, and then the bicuspid and tricuspid valves they close. Why? To prevent the backflow of the blood into the auricles, since they move from the auricles to the ventricles, and to prevent their backflow to the auricles, while the sigmoid valves they open. This is the opposite to that in the auricular systole. In the auricular systole, the bicuspid and tricuspid valves they open, while the sigmoid valves they close in the auricular systole. And the ventricular systole, the opposite, bicuspid and tricuspid they close to prevent the backflow of the blood from the ventricles into the auricles, while the sigmoid valves they open. Moving for the general diastole, which is 0.4 second. General diastole. 0.4 seconds. So the auricular systole is 0.1 seconds. The ventricular systole is 0.3 seconds, while the general diastole is the relaxation phase. It's 0.4 seconds. What will happen? Number one, the auricles and the ventricles, they relax. This is the relaxation phase. The blood flows from where to where? From the organs toward the auricles. The bicuspid and tricuspid valves, they open slowly, and the sigmoid valves, they close. So let's repeat this. Auricles and the ventricles, they relax during the general diastole. The blood flows from the organs to the auricles, and the bicuspid and tricuspid valves start to open slowly, and the sigmoid valve, they close. So here the cardiac cycle is divided into three different parts. Let's check them. First, we have the auricular systole. It's about 0.1 second. The ventricular systole is 0.3 second. So both of them, they are 0.4 seconds. So these are contraction for 0.4 second. While the general diastole is the relaxation. It's about 0.4 seconds of relaxation. So here we can conclude that the heart contracts as much as it relaxes, and every cardiac cycle it takes about 0.8 seconds. Classify in a chronological order. This is exercise number 12 on page 72. Classifying in a chronological order the four diagrams that show the phases of the cardiac activity. The black dots, they represent the pathway of the blood. And part B, give a title to each diagram and put in the appropriate order. Justify the name of each phase. Let's start with phase A. Phase A, the blood is moving from the auricles to the ventricles. The bicuspid and tricuspid valves, they are open here. So bicuspid and tricuspid valves, they are open, and the blood is moving from the auricles toward the ventricles, while the sigmoid valves here, they are closed here. The sigmoid valves, they are closed. So this is the auricular systole. So figure A is the auricular systole. While moving for figure B, figure B is the heart at the end of ventricular systole. Why? Because the ventricle, they are contracting and they push the blood toward the pulmonary artery and the aorta, and we have the bicuspid and tricuspid valves, they are closed as seen here. The bicuspid and tricuspid valves are closed, while the sigmoid here, the one in the yellow arrow, it's opened here. So this is the end of the ventricular systole. While moving for phase D, phase D at the beginning of the ventricular systole. So B at the end, while D at the beginning. While blood is found where? Inside the ventricles here. So bicuspid and tricuspid valves here, they are closed, while the sigmoid valves are still closed till now. They will open later on. So here is the start, or it's the beginning of the ventricular systole. Okay? While figure C, it represents the heart during the general diastole. Why? Because the heart relaxes, allowing the flow of the blood from all the body organs into the where? Into the auricles as seen here. So sigmoid valves, they are closed. Bicuspid are opening a little bit as shown here. So the beginning of the opening of these valves. So here, if we want to arrange them in the chronological order, the first is going to be A, have the beginning. So A is the beginning, auricular systole, then D, the beginning of the ventricular, B is the end, and C is the general diastole. So figure A, the heart during the auricular systole. The auricles, they contract to push the blood from the auricles to the ventricles. The bicuspid valve and tricuspid valve, they are open, The sigmoid valves, they are closed. Figure B, heart during the end of the ventricular. The ventricles contracted to push blood into the pulmonary artery and the aorta. The bicuspid and tricuspid valves are closed while the sigmoid valves are open. Figure C, it shows the general diastole where the heart relaxes to allow the flow of the blood from all the body organs to the auricles. Sigmoid valves, they are closed while the bicuspid and tricuspid are slightly opened. Figure D is showing the heart at the beginning of the ventricular systole where the blood is in ventricles, bicuspid and tricuspid valves are closed while the sigmoid valves are still closed. To solve this exercise, you have to study the notes about the phases of the cardiac activity, about the contraction and the relaxation phases, about the auricular systole, ventricular systole, and the general diastole, and what happens during each of these phases. Okay, guys? Thank you.